think he is.
Oh, okay.
Well, I see Commissioner Cooney and Commissioner Kearns, yeah. And Mayor Freeman, hello.
I'll log into the other meeting and
I mean, I just got a pop-up from Teams that says Al French just started executive session. So I think he didn't know to click on this link first, maybe.
He's just ahead of the game, Amelia.
I know.
Let a guy do his job. I mean, come on.
He's trying to look out for everybody.
Well, you know, Al loves him some executive session.
Oh, good to see you, Councilmember Stratton.
Good to be here. If I have cats jumping on the table, be patient with me.
They'll spice the meeting up a little bit for us. Let's see. I'll show that it's 12:30.
Was that Chuck?
Hello, Chuck.
Hey, Chuck, how you doing?
Oh, so Shirley.
You staying out of trouble?
There's going to be a couple, 2 or 3 months in recovery, I guess. So, I had a strangulation hernia.
Oh, that doesn't sound any fun at all.
No, they had to take 4 to 6 inches of my intestine out and everything else. And so I like to say and then that was the first operation. And then I had to go back for a second one, which in order to put a mesh over it. So I had 2 major surgeries in 2 weeks and my body just didn't quite hold up completely. So. But I'm still going to be around to pester you guys for a while.
Well, you let me know if you need anything. You're not okay.
This is Andrea Crosstead. Can I be heard?
We can hear you, Andrea. Yep.
Okay. I just can't pick up. I don't know what my screen says. I can't pull up what my screen, I have my name on it or if it has my son's.
It has attendee number 11 on mine, but.
Oh, okay. Well, I'm number 11 then today.
Okay. Well, welcome. All right. Well, I know past our 12:30 mark. I think we've got a majority of us here today. So.
Brian is running late. He will be here. He just got out of a meeting. Not here. I don't know about Betsy.
So, Ann, are you ready for us to call it to order, or?
I'm ready.
All right. Welcome, everybody. We'll go ahead and call the Spokane Regional Health District Health Meeting to order.
Here.
Mayor Kevin Freeman.
He's here, but he's muted.
Councilmember Linda Thompson.
Here.
Councilmember Betsy Wilkerson. I know that she has reported that she would not be attending today's meeting. Councilmember Karen Stratton.
Here.
Councilmember Brian Beggs is expected late. Commissioner Josh Kearns.
Here.
Commissioner Al French. He was just on.
I was going to say, I see him here and he shows unmuted, but Commissioner French, are you with us? All right,
Okay.
we'll go ahead. I know he's here.
Yeah. Commissioner Mary Cooney. Here. And Mayor Benwick.
Here as well. All right. For the chair's report, it's going to be pretty quick and brief. We tried the Adobe sign last month and it didn't quite work out, but we're going to try it again this month. So just look forward to hopefully we get an email for your signature documents electronically. And Commissioner, can you hear us this time? Just wanted to, maybe you can hear us or what you saying? Oh,
Yeah, I can hear you. I'm here.
To consider separately today? Seeing none, do I have a motion to approve the consent agenda?
So moved.
Second.
All right. Move from Commissioner Cooney and second was at Councilmember Stratton? Okay.
Yes.
All those in favor, please signify by saying aye.
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 All those opposed, nay. Motion is approved unanimously. Next, we have an executive session. Michelle, did you want to introduce, or you're muted, just so you know?
Thank you. The board will be going into executive session for two issues: the labor agreement application for RCW 4230-144A, and then review of public employee performance pursuant to 4230-110-1G. Amelia, are we thinking maybe a half hour, 45 minutes? How much time should we?
Yeah, I think we could start with 30 minutes.
Okay.
Karen, I think you should be going someplace else.
Yeah, Karen, do you want to exit the meeting or turn off your webcam and your microphone? Board of Health Chair has requested the executive session be extended 20 minutes. Board of Health Chair has requested another 20 minutes with an expected meeting reconvening at 1:50. Board of Health Chair requested an extension of the executive session for an additional 8 minutes. The meeting is expected to reconvene at 2 p.m.
Anne, you're on here. Can you hear me?
Yes, I can hear you.
All right. So we're starting to come back in, but I didn't know how long you extended us to.
You are good to go.
Okay. Let's see. I'm just trying to watch for everybody's faces here. Council President. Got the commissioners. I have not seen Mayor Freeman yet. Or Mr. Hafner. There's Mayor Freeman.
Mayor Witt, question while we're waiting on people. Based on the agenda currently and the time that we're currently at, I'm assuming we're probably going to have to run over. Is that correct?
Went over the 2:30 mark.
Yeah, just based on, we have action items in there. Okay.
Yep.
Depending on where we get to, I have patients scheduled at 3, so I need to be out by 10 minutes too, so that I can take care of some people that I've got already on the schedule.
Right.
So
Well, the first thing we'll do is the action, just to make sure we get the action on.
Yep.
No. Okay. Sounds good. Well, with that, I know we're missing Mr. Hafner, but hopefully he'll join us as we go through. So we'll go ahead and welcome everybody back, call the meeting back to order today. Thank you for coming back. And with that, we'll go ahead to the next item on the agenda, which is action item resolution 20-11, adoption of the 2021 Regional Health District budget. Amelia, did you want to introduce that?
Yes, you all have a copy of the balanced budget along with the resolution that would identify the expenditure authority needed for 2021. After the last board meeting, working with staff, we were able to get this balanced with a small surplus in here of $14,640. My recommendation is that we just continue to place that in the unassigned funds, and that's where we'll put remaining CARES funding as we get it in this year, because we don't know what kind of funding we will get for CARES next year. So that's my recommendation.
Okay. How about a motion? Does anybody feel like a motion, since I don't see any other discussion? Mayor Freeman?
Move approval of resolution as presented.
Second.
Thank you, Dr. Kidney. Any further discussion? Go ahead, Council President Biggs.
I have a motion. I don't know if it'll get a second or not, but I just want to make the point. So I would move to amend that proposed budget to take out the pay equity increase of $1.7 million until such time as the board has been fully briefed on what it means and what it accomplishes and how it'll impact us going forward.
Okay, do we have a second to the motion to amend? Not seeing a second. All right, the motion to amend fails. Okay, so back to the original question, which is the motion on the floor is to adopt the 2021 Regional Health District budget as presented. Any further discussion? Welcome, Mr. Hafner. All right. Mayor Freeman, did you have your hand up, or are you just ready for the question?
Just real quickly, I do just want to make a comment with respect to Mr. Begg's failed motion is that this budget, including the compensation package, does speak to the fact that we are going to need to take a deeper look as to either continuing or increasing funding and looking for other funding sources for the district. I hope that we will have that discussion in the very near future, but it is sobering to see where we are in the budget process right now, and we do know that this is not going to get better as it goes along.
Okay. All right. Well, I guess all those in favor for the resolution, please signify by saying aye.
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 All those opposed, nay.
Okay.
All right. Motion is approved with Council President Beggs in the nay. Next, we have a Resolution 20-12 adopting the Spokane Regional Health District Conflict of Interest Policy. Amelia.
Yes, if you remember, I brought a conflict of interest policy to the board back in the summer. It was identified through one of our audits for a grant program that we don't actually have a formal conflict of interest policy for staff, directors, and board members to sign. The board asked that I work with Michelle to make sure it was on par with everything that we also need to be doing for your requirements in terms of RCWs for Board of Health membership. So Ms. Fossum completed her review of it, and we have a completed conflict of interest policy and acknowledgement form here for you all. We do need to be in compliance by the end of November. So with your approval, I will begin working with staff to get this signed by all staff by November 30th. And then we will also need to work with all of you to make sure we have your signature as well.
Okay. Do we have a motion to approve the conflict of interest policy?
This is Linda Thompson. I move to approve the conflict of interest policy.
And I second that.
Thank you, Ms. Frostad. All right. Any further discussion or questions? Seeing none, all those in favor, please signify by saying aye.
Aye.
Aye. All those opposed, nay. Motion approves unanimously. Next, we'll go to Resolution 20-13, adopting a Spokane Regional Health District Board of Health evaluation policy for the administrative officer. This goes to Commissioner Cooney.
Yes, so we just wanted to make sure that we actually have a formal resolution and adopt a policy on how we do the evaluation for the health administrator, for the regional health administrator officer. And so that's what we are doing. Chuck and I are working on that. But we wanted to make sure that we just formalize that we need to be doing this annually. And so that's the resolution. I don't know, Amelia, if you want to speak any further to it. But again,
I think it's pretty straightforward.
Yeah, I think it's just, since I've been on the board, I don't know that it's been one done. I mean, I've been on 3 years, and it was 20 last year, and then we didn't have anyone during that last period. So we just want to make sure that this is formalized. So that way going forward, there will always be a review process.
Okay. Councilmember Thompson.
I have a question about, I didn't see a date. Is it annually? Is it biannually? How often is this? How often do we do an evaluation?
Yeah, it's annual. The first sentence there under policy, it says annual performance evaluation.
No, I don't see that on mine.
I don't see that on mine.
On the actual policy?
Oh, got it. Not in the resolution, but on the policy. Got it.
Oh, I'm looking at, okay. All right, thank you. Yes.
Yeah.
Awesome. Read the whole thing. Okay.
So many pages.
Never mind.
Mayor Wick, I move to approve.
Thank you, Council President. And seconded by Councilmember Thompson. Any further discussion? Seeing none, all those in favor, please signify by saying aye.
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 All those opposed, nay. Motion is approved unanimously. Next, we have Resolution 20-14, authorizing the Spokane Regional Health District Administrative Officer to enter into contract with MRSC of Washington for public works contracts and consulting services developed and maintained by MRSC through MRSC rosters.
Yes, if you remember back to January when the board approved our procurement policy, one of the things we discussed was having a small works roster in place, and per board recommendation, you asked that we reach out to MRSC to see if we would, as the health district, be able to participate in the small works roster that they have versus needing to, go through and make our own. We have confirmed that we are able to do that, and it's a requirement of MRSC that we have a resolution in place that shows that this is what you would like to have happen. And we've got all of the language in there required for that work. So we are bringing this to you because with approval, we will start working with them for our small works roster.
Okay. Do we have a motion?
I move to approve, this is Andrea, Resolution 2014. Administrative Officer, sorry.
That's okay.
Administrative Officer to adjourn the contract with MRSC.
Second.
Okay, thank you, Commissioner Kearns. Commissioner French, you have your hand up.
Yes, thank you, Mr. Chair. Question for Michelle. I sit on the MRSC board, have for the last 9 years. Do I have a conflict of interest in terms of voting on this resolution since you're entering into a contract with MRSC, or do I need to recuse myself?
I'm looking to see, is there a fee that we pay Amelia for that, or are we just allowed to be part of it?
I do believe there is a small fee. It's around $135. It's very small.
I'm not seeing that this is going to be highly controversial.
Probably not. But if there is a fee to be gained by MRSC, then I think it's appropriate for Commissioner French to recuse himself.
Okay, then I will be doing that. Thank you.
And Mayor Wick, just to correct, I didn't second that motion. I think that was Dr. Kinley.
It was.
I'm sorry. Thank you for clarifying that.
No problem.
All right. Any other comments or conversation? Seeing none, all those in favor, please signify by saying aye.
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 All those opposed, nay. And then exemptions or abstentions.
One abstention, Al French.
Okay. Motion is approved. Thank you, everybody. And that concludes our action items today, and we will go into reports of the administrative officer.
Yes, so, obviously my big work over the past month has been related to the budget. So not really a formal report from me, but I do have Lindia queued up to discuss the COVID-19 response as our incident commander. So I will segue to Lindia.
Good afternoon, everyone. I'll try to be pretty brief. I know you've had a long meeting already. So we continue to be in ICS and sending out a situational report every week. If you read the report and you think that it should be at a different level of information, please let me know. We're trying to really get that out to a variety of partners, so it's sometimes hard to know if we're too much in the weeds or if it should be at a higher level. We also continue to list the state resources as we hear about them so we can get that information out to all of our partners. In the safety area, we are looking at updating our internal guidance for staff because if you look back to where we've been over the last 8 months, things have changed and we realized we need to update some documents and safety messages to our staff. We are really clamping down on staff coming to work ill and reiterating how hand washing, distancing, and masking is needed in our workplace, as well as at home. We're conducting weekly risk assessments in our own facility and out at my place, and then the city will be doing, and they are doing, the safety report for the Immaculate Heart Retreat Center. We will get the first safety report next week from them. We are having some behavioral health concerns, not only about the community, but from our own staff or in our own staff. So doing some work internally to really support staff with different resources. And our wellness committee has been meeting on how they can really put something together around resiliency and how we become adaptable and flexible and really work on ourselves with self-care. We're potentially looking at the mental health first aid training and bringing that in for our staff. In the area of communications, if you haven't checked out our new COVID website, it's really slick. Kelly and her staff have done a great job with a contractor getting lots of great information on there. There's some fun videos and handouts, really trying to explain to people why masking is important. And there's some great materials to share within your own agencies. She will be sending out some messaging around the holiday concerns with large gatherings. So we have several holidays coming up, and that's what we're fearing is people are going to just gather in groups that will continue this pandemic. Our equity officer continues to host an equity committee call every 2 weeks. And those calls have been really instrumental in helping us understand barriers in our community. We try to bring in presenters or speakers that really can offer up different resources and describe what's available to different communities. And then they're talking about different concerns that they're seeing and how we can mitigate those barriers to services or whatever the need is. In the area of logistics, we have been moving all of our assets out of the fairgrounds by mid-December. We were told that we needed to find other places to put the stuff. The alternative care facility beds were returned to the state, but we did find out if we need those beds again, we'll be able to get about 50 beds in 3 to 4 days. So pretty easy to bring them back if we need them. Dr. Lutz is going to talk more about incidents and outbreaks, so I'm not going to say a lot about that area. We are starting to get our quality of life surveys in. There's about 3,000 surveys that have come in so far, and I think the deadline's a little ways out yet. What we are seeing is we're getting oversampled neighborhoods, and so they're more diverse responses this year, not just white old people responding to surveys. So lots of different diversity, which is great. And what will be interesting about the quality of life survey is we have the 2019 data, and now we'll have the 2020. And so we can really look at pre and post or pre and during COVID and seeing how it's impacting our community. Case investigations and contact tracing, we have added another team through the Public Health Institute. So there's 27 investigators there, plus we have our own 8 in-house investigators, plus our EPI staff. So we are starting to get at a better level to really, again, help our staff be able to manage their hours and hopefully take some breaks with vacations and holiday time and all of that. Care coordination, we have helped over 700 families stay home or isolate, which has been an interesting project for us. It's not something we normally do. We have 3 community health workers now that speak Spanish, Marshallese, and Slavic, and those individuals have really helped us with outreach to those communities that are impacted. One of the concerns or struggles that we're having is not all agencies in the community have the ability to use interpreters. And so we are working with some agencies to help them kind of beef up their ability to do that. We have been providing some technical assistance to the Spokane Regional Domestic Violence Consortium and really trying to expand the Handle with Care program that Jen Hansen started in the county. And then we are finalizing our child abuse and neglect website, and we'll start getting some messaging out around the ability of people to go onto that website and get information through social media. Healthcare system. Our capacity is continually monitored by the Ready Healthcare Coalition. And as you saw in the news, the system is stressed somewhat. We are a regional facility, so we do get patients from outside of Spokane County. We're also stressed by the high census of non-COVID patients in the hospitals. There's the bed capacity, and then there's the staffed bed capacity. And our staffed availability is a little bit stressed right now due to their own outbreaks in the healthcare setting. Community testing. Our challenge with community testing right now is just identifying all the different types of tests, who's doing the tests, what is the criteria of who they're testing. So our librarians, again, are being used in the city to help us with some research. And we're building out some matrices of all the different testing sites. Internally, we are doing some testing strategies because as new tests come on the market, we've got to kind of figure out who are they best used for and how should they be used, because there's always a limit in the number of tests. And then we are working very closely with the shelters on managing their COVID exposures and doing mobile testing at the shelters to help them mitigate their exposures. We're expanding our staff who are testing using our nurse family partnership nurses and community partner volunteers. So we had 2 individuals basically doing this testing, and we need to expand that work. With CARES dollars, we are buying some temperature scanners for the shelters and placing them in all the different areas so that they can really monitor people coming into the shelters. Vaccine planning is continuing, and what we have on our website right now is basically all the information that we have and know at this time about vaccine. So if you ever kind of want to know where we're at with it, it is on our website. We had developed a curbside vaccination model, and the staff just recently shared that model with the Department of Health, who is very interested in how we're doing that. We just finished up our school vaccination clinics using the model, and now we're going to also do our flu vaccine through it. So we're kind of preparing this way of getting vaccine out, along with our multiple partners that get vaccine out. We're really relying on the healthcare system, pharmacies, and others in the community to do this work. And then last, our business technical advisors have responded to over 2,400 requests from businesses, K through 12 schools, higher education, and childcare. And they are feeling pretty overwhelmed with the number of requests that they're getting for plan reviews, guidance, different situations that pop up, and just trying to respond to those most high risk and places that have the biggest impact of having an outbreak. So I think that's it. And then I think Bob will have some other information for you.
Good afternoon.
Go ahead.
Afternoon. I'm going to make my comments.
Oh, go ahead. Dr. Lutz.
Yeah, good afternoon. I'm going to make my comments brief for sensitive to your time, and I've got a meeting in 2 minutes. So our incidence rate is about 260. We've been above 200 since the beginning of September. Our positivity rate is 10%. And sometime this week, we will unfortunately we will reach the 200 deaths in Spokane County residents. We are at 199 as of today. We have 14 new outbreaks across the multiple sectors across our community, especially in long-term care facilities. And as Lindia mentioned, the hospital systems are certainly stressed, primarily as a function of staffing issues. We have currently 64 COVID residents or COVID patients with 19 in the ICU. Kootenai Health has 42 patients with 14 in their ICU. And as Linda pointed out, what's somewhat interesting, if you can call it that, is that the hospitals have a lot of patients who are not COVID related. So these are individuals who, for various reasons, may be putting off preventive care over the past few months. Now, acute on chronic injuries or acute on chronic problems are taking their toll. The last week, in conversations with them, when we had fewer COVID patients, nonetheless, we found that staff beds were becoming a premium. So I will leave it at that. Questions for me, please.
Questions for Dr. Lutz? Dr. Kinley, go ahead.
Yeah, I got a couple questions there for you, Dr. Lutz. One is I received information from a patient this week that on Tuesday they had the relation to someone whose family member had passed away in a Spokane hospital. At this time, I'm not naming any names of the individual or the location, but the individual was approached by the hospital and said by the hospital that they would pay for the funeral if they could list him as a COVID death. They came in completely unrelated to COVID. They ended up testing positive, and they did not actually pass at that time from COVID based on the medical understanding. The reason I bring this up is that when we're reporting situations of patients that are COVID positive in a hospital setting, and we talked about this in July, I feel like we need to start pushing the hospitals to track who's coming in with COVID-like symptoms and who is not, because they're being tested as standard protocol. So we're having asymptomatic patients being listed as COVID positive, but it's not giving us a true indication of when our facilities have COVID positive patients. If they came in for something completely unrelated, yes, we know that the system is stressed. I feel like this is going to instill more respect for the agency because they're going to feel like we're being more transparent with our numbers. That's a complaint I've got from a lot of people because they're looking around the country and nobody seems to be tracking this metric, and I can't understand why. Because if you're asymptomatic, we're not actually spending resources on COVID. We're spending it just like we would have healthcare dollars on something else. It just happens to be that they tested positive. If we're not using any of the medications, if we're not using ventilators, et cetera, for those patient populations. But we can't tease that apart, and I feel like that's making management difficult.
I will respectfully disagree with your statement, Dr. Kinley. It's routine protocol that when patients are hospitalized, irrespective of COVID symptoms, they are tested for COVID. If a patient has COVID, irrespective of what they are admitted for, the requirements of managing that individual, irrespective of whether or not they're on dexamethasone, remdesivir, it requires extra work on the part of the hospital. So again, there are strict criteria for what is classified as a COVID-related hospitalization, a COVID-related death.
And I understand what the criteria is. What I'm saying is that I'm seeing it clinically based on clinical reports not playing out that way. And I think that that's where the concern is coming in, is that it's like we see a lot of things in medicine. There's a lot of off-label use for medications. They give you a medication, but they say gabapentin is a prime example. Gabapentin is used for lots of different things, and it's off-label. And we say, well, there's strict criteria, but we're going to do X, Y, Z. And this isn't falling on your shoulders. This isn't your fault. But the reporting, I think, is not as accurate as it could be, and that's people in the public are getting a hold of information from firsthand personal experience, and it's tainting our position as a health department when it feels like we're not trying to track down and clarify any of this back to the public. And that's what I'm hearing from my patient base. That's what my patients have experienced, and that's what, as a physician, I've also seen with some of my patients who have also been tested.
Duly noted.
Any other questions for Dr. Lutz or the COVID-19 response?
Well, I do have a question that's kind of along the same lines, and how they started, if you can answer just how they started. It was for 17 years, they always documented on the death certificate how people passed and what was the cause. And so that was changed for COVID, and I was just trying to understand why there was that change. Because I kind of have a situation that I've heard different situations with families. And one family that I know, long-term care center, but this individual had a terminal illness in and out of the hospital and then had an accident and they passed, and then they found out on the death certificate that they passed from COVID. And they didn't want to say anything because they just don't feel comfortable. So how does that play out? What do we tell to the community? How did the change happen? And why is that? There must be some reason that we're not understanding.
There was no change. If a patient is tested for COVID-19 and they test positive, that's reported on their death certificate, as are other medical issues. So if somebody has underlying renal disease, for example, but they die of a heart attack, as additional diagnoses on their death certificate, renal failure, end-stage renal disease is commented. So again, there's been no change in how death certificates are done. Rather, COVID-19 is an accompanying diagnosis. If it's considered to be a contributing cause and/or the cause, then it's identified as such. So people do not die of COVID-19. They die of the related side effects, i.e. hypoxia, acute pulmonary failure. So typically what I'll see on the death certificates, and I have more than 90 on my computer, I will see acute hypoxic failure, COVID-19, and additional diagnoses. If somebody dies, for example, in a car accident, but previously, at some point in time, they had a COVID-19 test that was positive, that is listed on their death certificate, but it's not listed as a cause of death, rather accompanying diagnoses. There's been no change other than to add COVID-19 to the list of either causative factors or accompanying factors for death.
Okay.
And can I ask one more question here? There's quite a few questions revolving around schools. And the one public comment that we got today was on schools. Can you just go over the thought process with the school closures and how you have come to the decision about schools, how that whole process is taking place?
Schools are not closed. Schools are open, whether to in-person, to hybrid, or to remote learning. Schools are not closed.
Yeah.
There's not a single school closed in our community. Now, how they are providing instruction varies. Now, when we started meeting with superintendents 14 weeks ago, we looked at the metrics. At that time, given where we were with the incidence rate, which was 92, it was recommended that you strongly recommend, as I did, that you begin with in-person instruction. Many school districts followed that guidance, others did not. We have a variety of schools open across the district. I would argue that we actually have more schools open in this county than any other county across the state. We have the largest school district, Meade, in the state currently open. No other school districts are open right now to in-person instruction. Meade is. So again, in spite of the fact that our incidence rate right now is 260, which is well beyond the 75 per 100,000, which is again recommended for in-person, I should say for remote only instruction. We have students across this county that are in in-person instruction. I will continue to work with schools and guide them based upon our current data. We have been monitoring data very closely in schools to date. We have more than 85 children who have tested positive. I have about 80 plus staff who have also tested positive. In spite of those findings, I am still working with schools to provide more in-person instruction. It's an evolving situation, looking at our data.
Okay, so yeah, I meant in-person schooling, so I apologize. And I also didn't realize that early on you had urged people for one-on-one schooling. I thought in early August, there was the not to have one-on-one schooling. So I guess I misunderstood that.
Okay. Any other questions for Dr. Lutz or code response? Seeing none, Thank you, Dr. Lutz. Thank you, Linda.
I do have a
move
question
on.
for Linda, if that's okay. Linda, you said there was 2,400 phone calls that have come in for questions on how to comply and what they can do. Is there any way to do like just a conference meeting, or have kind of field all these at once rather than all phone calls?
That is a good question. We were actually just talking about that today. I think we are going to put some planning documents up on our website that people can go to that will help them with some of the guidance and processes. The problem is everybody has their own situation or their own thing that they want to run by us. And that's where kind of the individual consultations come from. But we are kind of trying to think through that. And also we may be doing some prioritization of low risk, medium risk, and high risk businesses and triage a little bit.
All right, thank you. Now we'll move on to the financial report. Is this Amelia or Mayor Friedman?
So that's, that was included in the packet. In terms of where we are year to date, we are still within our expenditure amount. This was all shared with the Finance Committee. And then I also included how much we have spent in our CARES funding. We have $8 million from the county commissioners that we can spend, and we're getting close to the 5 million mark. I think we're going to hit the 8 million by the end of the year. But just so you're all aware of where we are at this time. Happy to answer questions if there are any.
Questions on the financial report? Seeing none? All right. Move on to the legislative report. Not sure who to look for in this one.
Hi, that might be me. Hi, everybody. This is Amber. Hi, there I am. So the draft legislative agenda, it was included in your packet. What I'm going to do quickly is just tell you a bit about what the process that went into this, and then I'll orient you to the draft agenda. And I apologize for any background noise. Our office area is under construction today. So the way that this legislative agenda came to be is I first reviewed the SRHD program descriptions. There's every program submits a description of their program work and their policy work. So I read through all of those to look for areas where our programs work on policy issues, and I identified any specific bills or topics that they would have under potentially coming up under consideration. I then looked online at my favorite data sites, County Health Insights and County Health Rankings, to identify where our county has the highest rates of racial and socioeconomic inequities, and where our county is performing worse on health outcomes and health determinants compared to the rest of the state. What did I do next? I then reviewed, I also emailed staff and managers and our executive leadership team asking for policy topics that they had on their radar. I then assigned I reviewed the literature for upstream causes, and scientifically supported policy solutions for each of those health outcome areas where we're not doing so well. And also reached out to local jurisdictions, our typical community organization partners, to collect their policy priorities for 2021. You might yourself have received an email from me asking for those. And then based on those priorities and their suggestions, I reached out to a second round of partners who they suggested and asked for their policy priorities. Based on that, I had over 50 unique policy proposals in a spreadsheet, and then I scored each policy on their alignment with our program, the strength of the evidence behind the policy, the priority of the health outcome that the policy is targeting, the equity focus, whether it was related to a racial inequity or an economic inequity, and connection to factors and leverage points from our systems mapping work that took us last year to get through, and then a indicator that I called upstreamedness. So how upstream was it? Is it more treatment on the back end or upstream prevention? Determinants of health getting the highest score there. I created a prioritization matrix because I used to work in the data center to calculate a final score for each priority, and I ranked them from highest to lowest. So what you see in your draft legislative agenda are those policies that ultimately scored the highest and rose to the top based on all of that effort and criteria. Now I'm going to orient you to the document. You will see that there are sections, for example, public health infrastructure, violence and trauma. Within those sections, there's a little blurb for context, like a problem statement. And then the following bullet points are the specific policies that came out of that process that I just explained. So I hope that you had time to review the draft agenda. I know we don't have a lot of time for discussion today. The policy committee had some great feedback. So the red edits that you see in there are a result of the policy committee's feedback. And my computer just died on me. So hopefully you can still hear me. Okay. Well, I can't make any edits. I believe that it overheated. So I will try to make my edits by hand and just remember what the policy agenda looks like.
All right. And you all also have a copy of it in your packet that's redlined to show what the policy committee suggestions were.
Amber needs to do that computer. Sorry.
Yeah. Go ahead, Councilmember Thompson.
Okay, yes, I appreciate that you've got all of our edits in here, but I did want to point out under the violence and trauma, it says community stakeholders who participate in the county's 2018 assessment. If we look at that as the top issue facing Spokane, I think we should always use Spokane County or Spokane Region rather than just Spokane. I think that really fits with being the regional health district to make sure that all jurisdictions are covered in that and all citizens are counted in that. And I think that's the only place that I did just see Spokane. But I think for legislative work, region is good.
Okay, I'll do a little scan throughout the document to check for the use of Spokane and make sure that it does say county or region. Thanks for that one.
Good catch. Any other thoughts on the legislative? Seeing none. Appreciate you taking all the time and data and analytics. I know as an IT person, that's sometimes a lot of fun to get into.
My favorite. Well, I'm excited that this came together. I think it's a really cool agenda this year. I think that we have some opportunities to be very actionable with our community partners because that's where these ideas came from. So for next steps, this will go back to the policy committee where we will work on prioritizing these, which ones we will drive, which we will support, and which we will monitor. So if you have thoughts on those that you want to share in the meantime, please do.
All right. Thank you.
Thanks, everybody.
Yep. And so we'll see that at the next Board of Health meeting, which is scheduled for December 3rd. So we don't actually have a meeting in November, but we're going to go earlier in the month in December. So kind of merging those two together. And that'll be our final board meeting for the year. And with that, we are up for adjournment. Do we have a motion to adjourn?
This is Linda Thompson. I move to adjourn.
Second.
Okay.
Seconded by Dr. Kinley. All right, all those in favor, please signify by saying aye.
Aye. I just have a question about the awards. Was that taped by any chance? Because I would love to watch that.
Yesterday, yes, that the employee recognition, it was recorded, and it's actually really, really great video because we had to celebrate virtually. Staff were interviewed, and it was a great celebration, even though we couldn't be in person. But yes, there's a video of it, and I don't know where it's posted at yet, but Andrea, I will. We'll make sure you get a link so you can watch.
Yeah, I think that'd be great to see. Kind of help us give more insight on those and what's happening in the district and those who've put in all these great efforts. And
yeah, it was great.
Acknowledgement. Yeah, thank you.
Okay. All those opposed for the motion to adjourn, nay. All right, we are adjourned. Thank you, everybody.